One of the questions I get asked the most, especially by single ladies, is this: does Postinor 2 really work? Is it safe? Will I become barren? Today we're clearing the air once and for all. No judgment, just facts, truth, and real talk. Let's go. For clarity, I will divide this into two parts. In part 1, I will talk about the effectiveness of Postinor 2, or if it does work, and in part 2, I will delve further into how dangerous it can be, or if it is safe. Let's start here. Postinor is not an abortion drug. Repeat that after me. Postinor is not an abortion drug. It's a contraception drug designed to prevent pregnancy, not terminate it. If you're already pregnant, Postinor won't work, won't harm the baby, and won't stop the pregnancy, period. Next important point: time is everything. The earlier you take it after unprotected sex, the better. Postinor works best within 72 hours. That's 3 days. If taken in time, it's up to 85% effective in preventing pregnancy. But here's the thing: there's no way to tell if it worked until your period shows up. And yes, there's a right way to take it. If the pack has 1 tablet, take it immediately. If the pack has 2 tablets, take 1 immediately, then take the second one 12 hours later. Don't take both at once, that's not how it works. But always remember to check the expiry date on the pack before taking Postinor. Let's talk about what you're really worried about. Does Postinor cause barrenness or affect your future pregnancies? No, it doesn't. It doesn't harm your fertility, but you should not be taking Postinor more than once in a month. This is an emergency contraceptive. In other words, it is preserved for emergency situations, such as unprepared or unprotected sex, burst condoms, rape cases, failure in other birth control methods, and so on. It should not be your go-to every time. If you're sexually active, please talk to your health professional about regular birth control. Overusing Postinor 2 can mess with your period or cause serious changes in your menstrual flow and cycle. You might see periods too early or too late, heavy or very light flow, extra painful cramps, or your cycle may become irregular. If you're freaking out, breathe. It doesn't mean you're infertile, but if it gets too much, see your doctor. Does Postinor has a side effect? Just like every drug, Postinor has some side effects, but most are mild. You may experience nausea, dizziness, diarrhea, headache, breast tenderness, or even vomiting. Sometimes you won't feel anything at all. But if you're bleeding heavily or feel severe abdominal pain, get medical help immediately. Okay, now listen up. Taking Postinor in some situations may be dangerous, and if you are scared you might already be pregnant, please contact your doctor before taking Postinor 2. Again, don't take Postinor if you're in any of these categories without medical advice. Number 1. You have diabetes, heart disease, stroke. 2. You're breastfeeding. Number 3. You're taking drugs for TB, HIV, or epilepsy. And 4. You're underage. Even though it's sold over the counter in many places, I will still advise you to always talk to a doctor or pharmacist first before taking this drug. Look, emergency contraception is better, safer, and more acceptable than abortion. But it's still not a regular contraceptive, so use it wisely and protect your future. If you're still unsure, drop your question in the comments. I'll be reading. And don't forget to like, follow, and share with someone you know who needs to hear this today. Stay safe and choose wisely.